We live in an age of medical miracles where practitioners can repair, rejuvenate, or remove and replace parts of the human body. Learn healthcare and wellness regimens that can prolong your life and extend your active years beyond those of all generations in the history of mankind. Join us as we examine innovative procedures and new products and meet the people who make it possible. This is For Your Health TV.
Welcome back to For Your Health TV. We're here in our second segment, and our guest is Dr. Harry Collins from Savannah Age Management Medicine. Hi, Dr. Collins. How are you, sir?
Michael, thanks for having me. I appreciate it.
Well, thank you for being here. I have seen your name on buses, billboards, newspaper ads, phone books.
Right.
You are all over the place.
We're everywhere, everywhere.
And with the aging of America, first of all, just tell me basically what's your business all about?
Well, for the last 2 years, I've been affiliated with the largest age management medical practice in the world out of Las Vegas, the patient base of over 20,000 patients, and I brought those age management practice protocols to the Savannah area. We know that when a man and a woman both turn 30, you lose about 2% of your hormones every year. Decreased libido, decreased quality and quantity of erections, vaginal dryness, ladies feel terrible, decreased energy, decreased stamina, cognitive functioning, not able to think as clear, concentrate, focus, sleeping. And I don't know how old you are, Michael. Yes, I do.
Yes, you do.
But I know you don't want the hormone levels for your age.
I don't.
I'm 63, and I don't want the hormone levels for a 63-year-old. And my job is to get everybody back to those levels 25 to 30 years old.
Well, your office is in Pullman. I know you ran over here.
So
it's working.
Right.
It's working for you.
That's right.
Now, this is your second career, really. You had another career before this.
Right. I'm board certified in obstetrics and gynecology, spent 20 years in the military, trained at Walter Reed Army Medical Center, and I'm also certified in age management medicine.
And you told me out front you've delivered, what, 7,000, 8,000 babies
I think, yeah. We delivered at least one a day for 8 or 9 years at Liberty Regional in Hinesville, and at times we delivered sometimes 45 babies a month.
So this is not your first experience with hormones?
No. As a matter of fact, I've been dealing with ladies' health care and ladies' hormone replacement therapy for the last 25 years. But now what we're doing is actually hormone optimization. We want to get you back to that 25 to 30-year-old range.
So we talked before about having a tune-up with our previous guest. When do people start to feel the results of visiting your office?
Well, men feel the results a little bit earlier than ladies do, 2 to 3 weeks. Ladies, just a little bit longer. But the first thing you start to notice is your wives will start saying, honey, I notice an increase in lean muscle mass, more definition. Obviously, the libido's up. They also notice that too. Decrease in fat. As a matter of fact, a spare tire, that's the first thing to go, because when you and I were both 18 or 19 years old, we could probably eat 13 or 14 Whoppers a day, and we're still lean and mean. And you see what happens as we get older. Our nutrition's actually much better, but we get this spare tire and love handles. And that's the first thing to go, especially with testosterone optimization.
So for many people who don't have like a thyroid problem, is this often a good step toward a diet plan?
Well, we don't deal in diets, packaged meals, or I'm not a weight loss doctor.
Right.
But the fat is going to come off and replaced by lean muscle, and it's sustained weight loss also. Testosterone is not only the hormone of desire, but it's also the hormone for building lean muscle and decreasing fat.
So how does it apply? Is it an injection? Is it pills? How do you do that?
Well, our medical practice is personalized to the patient. There's pills, there's pellets, there's injections, there's creams. It all depends. We sit down with our patients. There's a complimentary visit first. I want to know all about your health concerns and your past medical history. And we actually talk about a plan that's best for you. Injections are like once a week. Bioidentical creams are twice a day.
And we talked earlier as well about this hormone thing and the news Prempro and how bad it is for people, and the difference between the injections that you give versus something like Prempro. Can you sort of differentiate that for our viewers? Sure.
When I graduated from medical school in 1981, the definition of a hormone was a chemical that's produced by one organ in the body, goes through the bloodstream, and affects another organ. Now we know that it pretty much affects every cell and every organ in your body. For example, the #1 organ that has the most receptors for testosterone is the heart. So it definitely protects against cardiovascular disease. The second organ in the body that has the most receptors for testosterone is the brain. Thinking cleared, helping improve short-term memory. There was a study that came out in 2002 called the Women's Health Initiative, and all ladies are scared to take hormones. The PremPro study that we talked about before the show today that came out today, well, that was actually the same hormone that they used back then, Premarin and Provera, which is PremPro. Premarin is made from it's a synthetic hormone made from pregnant mare's urine. The Provera is not really a progesterone, it is a synthetic progestin. And that study said that a combination of estrogen and progesterone increased the lady's risk of heart disease and breast cancer, which was probably one of the biggest disservices that we ever did for ladies at that time, because we had to stop them on their hormones.
And these are artificial hormones?
These are artificial hormones. Everything we're using now is bioidentical. And the word bioidentical means exactly the same hormones that a lady's ovaries are producing. And by the way, a lady's ovaries produce estrogen, progesterone, and testosterone, and the same hormones that a man's testicles produce.
Now, do they keep producing it after menopause, or do you replace the ones that they used to do, or is it consistent throughout their life?
No. We're all on the way downhill after age 30. A man has cells of Leydig in his testicles, and again, you lose about 2% per year after the age of 30. I'm 63. I've lost 66% of my testosterone. A lady the same way. Our hormones in the human body are mainly made for reproduction.
So a woman has a visible sign with menopause.
Exactly.
How do men know that they're sort of hit the peak and they're going downhill? Is it simply an age thing, or is there a way that you feel?
Men start to feel, the term's andropause, and men start to feel the signs and symptoms in their 40s. Decreased libido, decreased quality and quantity of erections, taking naps in the afternoon. Their quality of life is not exactly the same as it was when they were in their 30s. Energy's downhill. They're not at the top of their game in their professional life. Stamina, cognitive functioning. What I mentioned before, not thinking is clear, unable to focus, concentrate, and then sleep. We don't just look at testosterone too, Michael. We look at every hormone in your body. Growth hormone is one that we look at. It's secreted by the pituitary gland at night with a good night's sleep in a pulsatile fashion. Have you ever heard of the slobber sleep? You wake up and your pillow's wet?
I have.
Yeah, that probably tells me you're getting a good night's sleep, and that's where growth hormone is produced.
Now sleep is in the news a lot.
Sure.
Because a lot of people who are very busy, I know personally, I wake up several times.
Right.
Will this help that? Get you a good night's sleep?
It will. It will. Hormone optimization will help you get a good night's sleep and feel refreshed and relaxed the next day.
And what other, I'll tell you, walk me through the first visit to your office, and then maybe 6 months down the road, what are we going to see every month?
Sure. The first visit is absolutely complimentary, no obligation. I want to sit down and get to know the patient, know their health concerns and their desires. And one of the things I failed to mention is not only is hormone optimization meant to make you look good and feel good now, but everything we do is evidence-based medicine. And it's documented in the medical literature that it markedly decreases your risk factors for cardiovascular disease, diabetes, dementia, Alzheimer's, and even cancer. So after the initial complimentary consultation, if you decide you want to become a patient, we order a comprehensive panel of labs that looks at every hormone in your body, every organ system, and your cardiovascular risk factors.
Now, do you draw the blood and so forth at your office, or send them somewhere?
I have a contract with LabCorp. If you fast overnight, there's 3 locations in the Savannah area. Just drop by LabCorp. I'll give you a number, and they'll draw the panel of labs. It takes about 7 to 10 days to actually analyze your blood. In the meantime, I've sent you out a comprehensive health questionnaire. I want to know all about you before you come into the office. I need to do my homework. When you come in, we sit down and talk again about your health concerns. I've got about a 20-minute little video on nutrition. Again, no diets or meal plans. Just kind of tune up your nutritional status a little bit. You'll meet with a personal trainer, exercise physiologist that will do BMI, fat and muscle percentages, counsel you on exercise and nutrition. I will do a comprehensive physical evaluation from head to toe, check you for skin cancer, head, eyes, ears, nose, throat, heart, lungs, abdomen, check a man's prostate, and then we'll sit down and talk and design a program based on your health needs.
Okay, and that'll be the second visit?
That's the second visit, yes.
Okay, then when do we start the therapies?
Well, actually right away. In other words, if a man is like me, 63, I can't guarantee anything until I see his labs, but most likely he's going to need testosterone optimization. We actually write out the prescriptions at that time. The therapy started right away. I want to repeat your labs every 3 months because I need to know exactly where you are. And in other words, I want to get you back to that 25 to 30-year-old range.
And how often do you come in to just every 3 months?
Every 3 months.
So there's not a lot of time off of work?
No, not at all. As a matter of fact, every 3 months can be done by a phone consultation. The initial evaluation, we need to meet face-to-face for the complete comprehensive physical evaluation. After that, I want to see your labs every 3 months and talk to you personally, see how you're doing.
And what kind of things are you checking? Are you checking just weight, heart rate?
Yeah, all your vital signs. We're checking, in a man, I check his prostate to make sure it's okay, make sure there's no testicle lesions at all. And a lady, we do a breast exam, head, eyes, ears, and nose and throat. But on the labs, for example, well, I want to check his PSA, which is a screen for prostate cancer, every 3 months, at least for the first year. And a lady, we want to check her estrogen, testosterone, and other hormone levels also.
Okay. Well, thank you so much for being here. This is Dr. Harry Collins with Savannah Age Management Medicine.
Thank you for having me.
Hard to get it all out.
It is.
And your office is at 1000 Town Center Boulevard, Suite 506 in Pooler. And we want to mention your website is agemanagementmed.com.
Correct.
Okay. And we'll be back with more for your health right after this.